The future of healthcare is bright, but understanding it can be a little bit overwhelming. What happens in a world where medical knowledge doubles every 8 years, and 8 years from now it'll double every 3 years, and so forth? The world of healthcare is moving so fast, it's almost impossible to predict what it's going to be like in 2020. The only way we can do that is to look at some of the key trends that are going on right now. Some of those are that the aging population is overwhelming the system, that we as a country need to put our focus on preventative medicine and not fee-for-service care. The lower the hospital reimbursement gets from Medicare and other services like that, the more services in the hospital are going to be moved to outpatient settings or cheaper facilities. That's a good thing, actually. Innovation demand in emerging economies and developing nations all over the world is going to soar and continue to soar. As these countries get more and more money, they'll be hiring more and more people to figure out how to solve their problems in healthcare. As costs continue to rise, we need to figure out how to do more with less. It's almost impossible to do, but by getting jobs in fields that are getting jobs at companies that are forward-thinking in fields that are going to be around in the future, that are going to be big in the future, we can be successful as managers in the healthcare environment. Meet Eric, a 23-year-old self-starter from Boston, Massachusetts, who got a job at a technology company developing rehabilitation services. This is an example of what the future of healthcare might look like. By working for Microsoft, Eric is helping develop some of the most innovative technology the world has seen for healthcare. He's coming up with ideas and testing new developments, and has a very hands-on approach to health information technology. Eric is developing a strong name for himself by working at one of the most technological advanced companies in the world. This will ensure that when someone sees his resume, it looks like he knows what he is doing, and will help him get a management job overseeing the future of health information technology. Melody, 21-year-old graduate from Towson University with a degree in healthcare management, got a job at Chai Baltimore working with the elderly as a project coordinator. Chai Baltimore is a company that is trying to develop homes for elderly people that are in a community that aren't in assisted living facilities or things like that. People living in society. They will have people sent to the home who will take care of them, do groceries with them, eat with them, check on their blood pressure, and do other types of services in the home at a very reasonable cost. As Medicare continues to cut reimbursement rates to hospitals, and funding in general for hospital services diminishes, more services will be moved to the home and outpatient care settings. It is very easy to become an administrator at Chai. All it takes is one certification and one test to pass. That will take her to the next step and continue her career in a positive manner. Maloma, a 21-year-old graduate from Towson University with a degree in healthcare management, they got a job developing health policy in developing countries like Ethiopia. As economies continue to emerge all over the world and developing nations get more and more money, there's going to be more demand for health services. Most of these countries are very poor, so there's a demand for new types of healthcare that work just as well as the old time. A lot of services are being done through the internet, Skype, and things like that. Things that aren't very cost effective will not work in these types of areas. Maloma's job is to interact with the people of these countries and communities to find out what it is they need and what they are suffering from the most. And he needs to manage the finances and find out how much it's going to cost to treat these patients and provide aid. He also needs to integrate technology into their communities to show them how to receive healthcare through Skype and things like that. By having experience developing health policies, you'll be able to get a job at any consulting firm.